Well, according to a small study out of the University of Miami, in fact, COVID-19 can affect the penis. What happened was a testicular biopsy was done on a man who had survived a pretty severe case of COVID-19. And in fact, this biopsy revealed the virus was present in his testes, and we're talking about 3 months after the initial infection cleared up. So if you're out there and you're a man who's had COVID-19 and is experiencing testicular pain, I think it's reasonable that you consider that the virus, as we discussed, has invaded the testicular tissue. So in a case like that, I think you really need to go see your urologist, go through a complete exam. And
100%, and this brings up another important topic, which is, can it decrease our sperm count? Right? Because there's that stuff that's going around that says, well, the vaccine does, COVID does. Here's the truth. The vaccine does not lower your sperm count, but the virus that causes COVID does. So vaccine good, virus bad.
Well, if you need another reason to get that vaccine, there it is, guys. There's nothing more important than the junk in the trunk, right?
Absolutely. So, Joe, let me ask you this. Do you think that these findings could change some of men's minds about vaccines, what we're just talking about?
Oh, I think it's one thing if you're afraid about coughing and the sniffles, but when it starts to affect you below the belt, then men are going to pay attention. Yeah. I know I never say no to a free vaccine. So I was first. You know, I'm obviously not a doctor, but I would say for someone who's having problems down there, getting it checked out, and who knows, you know, maybe more frequent release would be the thing to help you out with that. But I tend to prescribe that for everything from migraines to sprained ankles. So.
All right, let's change gears a little bit. They say even the smallest clown can impress the crowd under the big top, which brings us to our next topic. We're taking on one of the biggest bedroom debates of all time. Does size matter? Dr. Ish.
Well, listen, when it comes to sexual activity and guys, it's a harder sell, right? We've got to be showmen. I remember when I was a kid, when the circus came to town, they said it was the biggest show on earth. They didn't say it's an average show that you might want to check out if you got some time.
It's got to be the biggest show on earth, right? So obviously the answer is yes, but it's all about that bell-shaped curve that we have in science. I think for the majority of men, they're within that normal range. I think it's that lower end of the bell-shaped curve. In that case, then maybe there are some things you can look into.
Pay some attention to it. Yeah.
All right, so Joe, we're going to you. What do you think about does size matter?
Size always matters. It for everything. You don't just go into Starbucks and say, "Give me a cup of coffee, any size." You know, they'll say, "Do you want a venti or do you want a 3-ounce shot?" And that one has to come with.
Or do you want that Magnum?
Yeah, exactly. So size does matter, but like you said, there is that curve to it, so that, you know, there's definitely a range where you don't have to be a porn star, but you don't have to go see the doctor. Otherwise, you know, you want to hit that nice. It's so hard to talk about this without just a series of innuendos and puns, but you do want to hit the sweet spot on the bell curve.
Yes, you do.
Yes, you do.
And if you're lower on the bell-shaped curve, you got to do what you can do to move on up on that curve, right?
Yeah, then I recommend creating optical illusions in the bedroom. Maybe, you know, always have sex with a chihuahua nearby. It makes you appear larger. And if you have a ruler in the bedroom, make sure it's on the centimeter side, because 10 centimeters sounds pretty impressive.